You're listening to the ATS Breathe Easy podcast, brought to you by the American Thoracic Society.
Welcome, everyone. My name is Dr. Amy Attaway. I am here with another episode of the ATS Breathe Easy podcast. And I am so excited to have two really wonderful guests on this podcast. So this podcast is going to be to really promote the upcoming World COPD Day. So I have two expert COPD people with me to discuss that further. And I have Dr. Rachel Evans, who is a respirologist, or also known as a pulmonologist from the University of Leicester in England. And she's a global leader in exercise physiology and rehabilitation in COPD and other chronic medical conditions. So thank you so much, Dr. Evans, for being here. And I also have Russ Winwood. So Russ Winwood is a patient advocate. He's also known as the COPD athlete. He has had an amazing journey and always talks about that he doesn't let his COPD diagnosis define him. He has an amazing story and has participated in a number of marathons, Ironmans, really highlights the importance of exercise and pulmonary rehabilitation in COPD. So thank you. Welcome, Russell. And I think the really
Glad to be here.
Yeah. I think the really amazing thing about this podcast, it's 6 a.m. in the United States right now, Eastern Standard Time. What time is it for you, Dr. Evans?
Oh, very civilized here, 11 in the morning. Sorry to both of you.
And then Russell, what time is it for you?
We're 8 p.m. So just had my dinner and ready to go.
Okay, wonderful. So I think, yes, I'm really excited. We're coming from all over the world to do this podcast. And so I think we really want to talk about pulmonary rehabilitation. And so how the history of it, how it was first developed. I think, Dr. Evans, that's something that you know a lot about. You're an expert in that area. So how can we really highlight pulmonary rehabilitation and emphasize its importance?
Yeah, well, I suppose first we need to think about what we actually all mean by pulmonary rehabilitation. And I think that sometimes is the beauty and the crux of the issue is that it can mean many different things, especially across the world. So ATS has been instrumental in trying to get definitions of exactly what we mean by pulmonary rehabilitation together alongside the ERS. So we largely now think of it as a structured program. It's got lots of different ways how it can be delivered, but it has to be structured. Core components of exercise, education, supporting people to self-manage. Really key is the skill set of that multidisciplinary team. So it's certainly not led by just medics. You need to involve physiotherapists, nurses, occupational therapists, a whole load of different allied healthcare professionals to really put together the programme. So I suppose another key thing for clinicians to understand is that and for patients is that it targets all the effects on the body that having a disease like COPD can manifest. So it doesn't particularly target the lungs. It targets the way that we sense symptoms. It targets the way our muscles behave towards symptoms, and ultimately it tries to improve symptoms and quality of life. It helps people feel better.
Mm-hmm. And I think that I really like how you summarize that. It's like really giving you're learning a lot of different techniques that you can carry forward in self-management. Russ, do you want to talk a little bit about that? Because you have such an amazing journey. And I think you you didn't necessarily know about pulmonary rehabilitation when you first started. Is that right?
Yeah, so I was diagnosed with COPD 14 years ago. So we used the terms of stage 4, that nasty term end stage back then, which we don't use anymore. So for me, at that age, I was only 45. It was quite a daunting prospect. I was referred to pulmonary rehab eventually, and unfortunately, our system in Australia back then was quite broken. So I would make phone calls. I wouldn't get a call back. Then I'd find out that that particular program was closed down because of lack of funding. And so fast forward to nowadays, pulmonary rehab is certainly a lot more organised. It's a great way for patients to learn about their disease, manage their disease, but also moving forward how they can improve their quality of life. And I think the important thing for patients is to learn about how they manage their disease between doctor's visits. So, patients, and I'm no different. We have times where we just wait for our next doctor's visit and hope that it's a magic new medication, whether it's an inhaler or a tablet or whatever. But that's not so proactive. We've got to be proactive, and pulmonary rehabilitation is a good starting point.
Mm-hmm.
And that's key, Russ, isn't it? That starting point that
Mm.
although it is a program, and quite often that's an 8-week program, twice a week, as we said, structured, but it's really the key is the learning that hopefully then goes into day-to-day life for people, isn't it? It's not
Absolutely,
like just
and
taking a tablet and off you go.
no, and I think it's I always say the biggest thing you can learn with managing this disease is consistency, and that's consistency with day-to-day activity, consistency with taking your medication, and all those things we need to do to manage our disease well. And we can get taught that in pulmonary rehab. So yes, it's the starting point we all need to get to.
That's a great, and I think one of the things I've also heard from my patients is that you feel like a sense of community. Like you have all these people who are really there to help you, but you interact with other people with COPD. So you all kind of like my patients have described it as kind of a support group as well, knowing that you have all these people that are here to help you, and then patients that also are you're kind of learning from their journeys as well.
Absolutely, I think I think that's a big component of it is having that network that you can support on. Myself, I have a coffee, every so often with a patient friend of mine. He's gone through a double lung transplant, but we connected over exercise and activity and how important it was. So, and still is. So, the connection you get with pulmonary rehab is just one of the benefits.
Yeah, absolutely. And that's very true of the face-to-face programs. But we also have to be mindful that geography, particularly in America and Australia, don't always lend itself, isn't it, for a face-to-face program. So there are other ways that rehabilitation is delivered, but we just have to make sure that those key components are still there. And actually, there are ways of having online communities. I just want to put a caveat though for the clinicians listening to this is that rehabilitation is very different to peer support. Peer support is really important, but pulmonary rehabilitation really is a treatment of exercise and education.
Oh, thanks. Yeah, then that's great to clarify. And so I think one of the things that we're kind of highlighting is the importance of pulmonary rehabilitation. And I think one of the things we are well aware is that it's underutilized. And so like Russ was saying, he kind of didn't know about it right away, and that there's some barriers, I think, to these programs. I can talk about I know from the United States perspective, we have issues with insurance coverage, reimbursement. You talked about the geographic, sometimes it's just there's just not a lot of locations in rural areas. What are some of the barriers that we're both of you have noticed, or things we kind of need to work on?
I think it's universal. It's funding. In Australia, that's one of the issues we've had is a lack of funding for pulmonary rehabilitation. I think us in the community, the respiratory community in Australia would love to see governments making pulmonary rehab affordable and accessible to everyone. We know that that's going to make a patient healthier. It's going to mean less hospital admissions. It's going to mean less burden on healthcare in general. But we seem to be spinning our wheels a little bit to get to a point we need to.
Yeah, absolutely. And it's that message back to the policymakers, isn't it? This is a really high value treatment. If you want to help the individual and reduce burden on your healthcare system, then you would absolutely make sure that pulmonary rehabilitation was available. Because Amy, to the clinicians and any scientists listening, pulmonary rehabilitation is really cost effective as well as clinically effective. So it is a win-win. And the World Health Organization has recognized this, and it is in their package of care that they're recommending healthcare systems deliver. Rehabilitation really is now front and center, and certainly for pulmonary rehabilitation and COPD is highlighted there.
Yeah,
but she says, with a draw of breath, in the UK, I would say that we have that it is on the policy makers' radars. It is supposed to be something that is implemented. So the will and the funding to a reasonable extent is there, but we still have under referral. And that's why things like this podcast are so important, because we need to get the message out to patients that they go to their clinicians and request this so that they know this is something that they should have, that they understand about rehabilitation and that they understand how to refer. And I think until we get that front end really sorted, even if we've got the programs there, we're still not getting everyone to utilize it.
mm-hmm.
It should really be a part of your initial diagnosis. We're given a bunch of new inhalers, so we need to have to learn to use those inhalers effectively. And then secondary to that, we should be prescribed pulmonary rehab. I think it's fair to say it's suitable for most people. So they're good starting points. And I guess for a clinician, and I'm not blowing my own trumpet, but if you want to see what the benefits of exercise and following the standards that are emphasised in pulmonary rehab, I'm probably it. And I'm not alone. There's many patients who are living a really good quality of life with a very severe disease. And I always say, don't judge a patient by their numbers, their spirometry. Judge them by what they can do, the will they have to lead a better life.
Yeah, absolutely, Russell. I wonder if you'll just give us a little bit more. You are not blowing your own trumpet. But I think it's helpful for listeners, if you don't mind, just explaining when you say your numbers, what your numbers actually are in terms of spirometry and what you've actually managed to do and how you've managed to train the rest of your body, because it is phenomenal.
I guess the thing is the starting point. So my very first spirometry in my clinician's office registered 22% FEV1, so 22% predicted. And back in those days, my day would consist of going to work for maybe a couple of hours and then coming home and sleeping, because the cost of breathlessness is exhausting and you were just tired all the time. And so for me, exercise has been the main catalyst into improving my quality of life. I could sit here and rabbit on about 14 years of my journey, but I think the important numbers is now my FEV1 hovers around 35% of predicted. I still have severe disease. That's not going to change, but I work full time. I work, 40 plus hours a week in my regular job. I still run marathons every year. Every day is an active day for me, whether I'm training or not. I have my goal of 10,000 steps a day, and I hit at least that most days. And so it was like I was talking about before, none of this would have happened without consistency. When you see the improvements and you see the difference that exercise and just mindset and just general lifestyle changes, when you see the difference it can make to your quality of life, it's quite inspiring. Just to know that if you keep going, this is what can happen. And as I say, it's not just me. There's plenty of patients out there who are high functioning COPD patients with severe disease. So, don't just take it from me. There's plenty of others out there as well.
Yeah. And I think it's so, it is very inspiring. And I always say to the patients I see on a Monday morning, I don't run marathons, so I can't be a hypocrite. I'm not expecting them to go out and run marathons, but it really gives an example of how much the rest of the body can do with exercise, even when the lung function is still, albeit better, Ross, but still only a third of where it should be. And that's what I think is really helpful to patients, rather than it coming from someone like me, but hearing it from you that, exercise, and you're always very clear to say, in the realm of what somebody wants to do. Not everyone wants to run marathons, but they can use exercise for their goals, and everyone's very different, isn't it, of what they want to achieve.
Oh, absolutely. And, marathon is my chosen endeavor, until I can't. But it doesn't have to be marathons, There's plenty of patients out there achieving big goals just by doing consistent, regular exercise. And the human body is amazing how it can adapt. And I'll just tell you a quick story of a patient in the UK a few years ago now. She wanted to do a half marathon, and her biggest problem was how she was going to get her oxygen tanks around a marathon course. So because she was so determined to do it, she ended up putting him in a pram and pushing a pram around a course and completing a half marathon. And to me, that's just a great example of what you can do. And she was a great advocate of pulmonary rehab. So, I can belt out all about pulmonary rehab all day long. I never get sick of talking about it because it's just so crucial to manage your disease.
Oh, I love that story. And I think as clinicians, and I'm curious what you think, Dr. Evans, but sometimes I hear like, when should I encourage pulmonary rehab? At what stage of the disease? A lot of times it may be a patient who is not necessarily getting it from the beginning or being encouraged to participate in some kind of exercise program from the beginning. But I do think that many of the GOLD guidelines, they recommend like a symptomatic COPD. It doesn't necessarily have to be someone who's having a lot of exacerbations. So I always highlight that with my fellow clinicians. I always talk to my patients about that. And then I think it's so like the story you told about how functional you became, right? Like, so you were from like where you started to where you are now, just really highlights, and I think you talk about this, right? Like exercise is the best medicine you ever found, right? For your COPD. So.
Absolutely.
Yeah.
Clinicians, want to feel more confident caring for patients with serious illness? The American Thoracic Society and the Center to Advance Palliative Care have teamed up to bring you a brand new 7-course CME series on ATS Ed Plus. You'll learn practical, real-world skills in palliative care basics, symptom management, and communication for tough conversations. All designed to help you make a difference at the bedside. And the best part? You'll earn CME credit as you learn. Find the full series on atsedplus.thoracic.org.
We've been talking a lot about pulmonary rehabilitation and its importance. And then I think the other thing we wanted to talk about was how to raise awareness for COPD, for pulmonary rehabilitation. And that I think that segues really well into the World COPD Baton Pass. So Russ, do you want to talk a little bit about that?
Absolutely. I love it. I can talk all day about it too. To give people a little bit of background, myself and respiratory physio in the UK, Dr. Ruth Barker, we got talking about 3-4 years ago now about how we could create awareness for COPD, but really emphasise the importance of activity and exercise. And so after many months of talking, we come up with the idea of the COPD Baton Pass. And what that is, it's an event we hold on World COPD Day, this year, the 19th of November. We hold it each year. And it's a 24-hour event. So it runs over the whole day. It starts in Australia and New Zealand early on World COPD Day for us. And it finishes in the US at the end of their World COPD Day. What it actually is 3 links that we hold on the Vimeo platform, and the day is full of education about pulmonary rehab, about exercise, about lifestyle changes, and how we do things in Australia and New Zealand, how people do things in the UK and Europe and in Africa, and then across to the Americas. We have sites all around the world. So last year we were viewed in over 40 countries. And what's wonderful is we're getting now sites in countries where they don't have a lot of resources. And so they're looking to see what the world does and how they can best adopt practices into their own clinics that can help their patients. So the Big Baton Pass, as I say, it's on the 19th of November. On Wednesday, World COPD Day. You can get more information by going to our website, which hopefully we'll put in the show notes, but it's www.copdbatonpass.org. This year, we're also doing a global step challenge, and this challenge is open for patients, clinicians, anyone really involved in the respiratory community, and that can be carers, it can be families. We don't care. We're sort of framing it a bit like the ice bucket challenge that was very popular. This will be a step challenge on the day, and our goal eventually is to have enough people involved that we walk around the earth, which is 55 million steps. So we've got a target. I'm not going to say we're going to get there this year, but it's a target we can hopefully get at some stage. But I guess the whole emphasis of the day is the importance of activity and access, and how people can get prescribed pulmonary rehab in their different countries. So I would urge, whether you're a clinician or a patient, to log on the day and have a look. If you want to get involved, you can fill out the contact us page on our website. I think we're getting pretty close to being full this year, but we can always squeeze people in to do a presentation, to do a live pulmonary rehab class. That's the sort of thing we like to highlight on the Baton Pass.
Yeah, and last year, Russ, I think there were many different countries where we could actually see how rehabilitation was done, and like you say, in low resource countries as well, which was just fantastic. And I do want to do a little shout out for your family because I think your family must have walked halfway around the world, didn't they? It was from grandchildren all the way up. It's absolutely wonderful. So there is a really good feel good. There's a serious motivation behind it, but it's a really good feel good 24 hours, isn't it?
It is, and as I say, for me and for Ruth, we just felt like World COPD was a lot of little bits of celebrations here, there, and everywhere. And to us, the Baton Pass was a way of uniting everyone to celebrate and to shine a light on COPD through World COPD Day, but then go one step forward and highlight the importance of activity, the importance of pulmonary rehab. And, we have singing groups that are involved because singing for your lungs is good. We have harmonica for health. So it's not just about hopping on a treadmill or riding a bike or whatever. Exercise can take all sorts of various forms.
Yeah, I really enjoyed because I think I watched the previous Baton Pass and then I got to participate a little bit in last year's, but I think I learned so much just like things that I never thought about, like things that I encouraged with my patients. So I think we all have so much to learn from each other and just like bringing everyone together on one day. I think is it 48 hours total? I can't remember. Or it's just 24.
24.
It's just 24, but it's
24 hours. That's enough. I've got to stay awake for those 24 hours.
I was just about to say, we let Russ and Ruth sleep a little bit.
I know. Because Russ will, I don't know, did you, but you'll be on the treadmill or one of your family members, right? For 24 hours.
No, we've changed the format this year. So it's all about the treadmill challenge or the step challenge.
Mm-hmm.
So it's about everyone getting on that. Yes, I'll definitely be on the treadmill for a number of hours this time around. But what we really want to do is get everyone involved, bring everyone together. My treadmill at home is now broken thanks to 2 years of the Baton Pass. So it's time to move away from the treadmill and get everyone else involved. And that's what we're wanting to do this year.
Oh gosh, that's wonderful.
So just to clarify, if people want to get involved, clinicians or patients, in your step challenge, how do they do that?
So if they go to the website, they'll see on the homepage there is a QR code. They can scan that QR code, they download the app, they join the team, and away they go. The app can sync with just their phone, so they can record their steps on the phone. If they have a wearable, then they can sync it with that. It doesn't really matter how you record your steps, and it doesn't really matter how many steps you do. What we're trying to do is create community and getting everyone involved. And we run a separate step challenge through the year just with patients. And it's fantastic because we have some patients who might do 25,000 steps in a day, but we'll get some patients who might only do 200 or 300 in a day, but their 200 to 300 steps are just as important as those 25,000 steps. And I was only talking to a clinician today about a particular patient in this group who said to me when he joined, I don't think I can do any more than 500 steps a day. And the other day I saw he did 3,000 steps in a day. And, that's the sort of thing we love to see because people are getting engaged and it's not a competition. It's just about a community. So everything we do is at a group. There's no individual competitions.
That's wonderful. And we'll make sure all of this information is in the show notes, like we had mentioned, so that everyone can participate this year, which I think we're all really looking forward to.
Appreciate that.
Yeah. All right. So I think this has just been such a wonderful conversation. I really want to thank again Dr. Evans and Russell for joining us today to really talk about pulmonary rehabilitation and promote the Baton Pass. I just want to thank you both so much for being here, and also all the work you do for our COPD patients. It's just so amazing and crucial, and I'm just really grateful to both of you.
It's a pleasure, and if we're coming to the ATS, the Baton Pass, next year in Orlando, and we're going to have the cycle challenge again. I think you saw it there, Amy, this year. It's back, so come and visit us at the booth and learn all about COPD from a patient's perspective.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more ATS Breathe Easy podcasts on Transistor, YouTube, Apple Podcasts, and Spotify. Don't forget to like, comment, and subscribe so you never miss a show.